I'm going to hit record.
Perfect.
Okay. And then Lucian, if you want to go ahead and let people in, and we'll get
Sweet.
started right at the top of the hour.
Sounds good. Open them right now.
Welcome, everyone, to the Age Well series. We'll get started in just a minute. So nice to see so many names on our screen today. We're going to wait just another moment and make sure that everybody gets in from the waiting room before we get started today. Lucian, how are we doing?
Yeah, looking good. Good.
All
Got
right.
everyone
So
in.
all right, great. Well, I am going to get everything going right away. So I am Amy Ryan, and I am one of the health promotion program coordinators here at the Wisconsin Institute for Healthy Aging. And I'm just so happy to have everyone here today. And before we get started and have Patty, Dr. Patty Siegel, talk a little bit about oral health, I do just want to give a little bit of background about WEHA. So WEHA is the Wisconsin Institute for Healthy Aging, and our mission here at WEHA is to improve the health and well-being of all people as we age, because we are all aging. We're going to encourage you to learn more about our programs and our initiatives on our website. And if you have not signed up for our Age Well newsletter, we'll encourage you to also sign up for that. Just a couple of housekeeping items. We are going to have all of you muted during our presentation today with our cameras off. We are recording this webinar and it will be emailed out to you, all the registered participants, after the presentation. It will probably be emailed out later this week. If you do have any questions today during the presentation, we're going to ask that you put them in the chat. And we'll have time to answer those questions at the end of our session today. Let me just make sure that I'm on the right page. So with that, a few housekeeping items. It's my honor to introduce Dr. Patty Siegel. Dr. Siegel has a dental degree from Marquette University and practices at Algoma Family Dentistry. And I'm going to stop sharing my screen. And Dr. Siegel, I'll let you share your screen and you can go ahead and introduce yourself a little bit more.
All right. Let's see here. Share. All right.
And we can see your screen.
Awesome. Okay, perfect. So we're good to go, right, everybody? Okay, welcome to the Oral Health and Healthy Aging webinar today. I picked this lovely couple here. They're happy, smiling. Look at their beautiful teeth. I'm Dr. Patty Siegel. I'm going to be presenting to you today. And when I think about oral health, I think a lot of times it gets missed, when we think about overall health. So I really like this quote that oral health means much more than just healthy teeth. You cannot be healthy without oral health. So let's dive in here. This is me. I know that Amy gave me a nice introduction there, but a little bit more. I've been a general dentist for 16 years. I currently work at Algoma Family Dentistry in Algoma, Wisconsin, and I graduated from Marquette in 2009. I went on to do a general practice residency in Burlington, Vermont, and then came back to Wisconsin, where I spent the first 10 years primarily in public health dentistry. I was treating underserved patients in Door County and Green Bay, Wisconsin. I am currently the chairperson of the Wisconsin Oral Health Coalition Steering Committee, and our main focus in that group is focusing on access to care and equity in dental care. Um, I am very passionate in dentistry about connecting with my patients, and I work really hard to educate them with the goal of avoiding unnecessary treatment, any preventable dental work. I want to empower my patients to make, uh, choices every day that lead to better oral health and overall health outcomes. This is a picture of my family. Jonathan there with me, he's 12, and Eddie is 9. And on the right is my husband, Craig. He's a 7th grade math teacher at the middle school in Sturgeon Bay. All right, so let's get into it. We've got prevention is the best medicine, and I really believe this to my core. Dental disease, for the most part, is preventable. And, I say that now with the full understanding that we are here on a live webinar for mature adults who have had a lifetime of already completed dental treatment. And, I wish I could get to all children before they develop their first cavities, or parents and grandparents, so we can share this information and hopefully help to avoid unnecessary dental treatment. Because, if I'm being honest, I completely understand and realize that dentistry can be painful physically, emotionally, and financially. So, I'm sure many of you listening today have stories that you could share of less than excellent dental experiences. And I'm always sad when I hear those stories in my office of patients who are afraid to come because of some experience they had when they were younger. I wish we could just go back in time and prevent it from happening at all. And that's a big part of our discussion today. So I always think this is interesting. This is a little bit older. I want to say this slide is from like 2013, maybe, but it's still an interesting graphic. And, if a 10-year-old gets a cavity filled in a tooth, one tooth, by the time they turn 40, you will have paid over $1,000 in services to maintain that filling. And on average, it can cost $2,187 by your 79th birthday. And this is per cavity, per tooth, and it's well above the lifetime cost of preventative care. And that's probably an underestimate in 2025 dollars. But the point here is that our first molars are 6-year molars. Those are the teeth that we get when we're 6 years old, our first permanent molars. They are the most heavily restored teeth in adult mouths. And they grow in at a time when we're maybe not very good at brushing, and we tend to eat more snacks throughout the day. But when we do a filling on one tooth, we have to drill away the cavity and place a filling. And for many of you, those fillings might have been the old silver mercury type of fillings. And cracks can develop around those, or the fillings can leak, or you can get another area of decay underneath. Sometimes a new filling needs to be done, or a crown, or a root canal, or extraction. But as you can see, just having that one filling done, more problems come down the road. So this is where preventing things in the first place is always the go-to if you can get to things early enough. So the key topics today that we're going to discuss are the links between oral health and nutrition, oral health and systemic health connections, healthy habits to aid in prevention, And at the end, we're going to go over some very common dental problems in older adults and some things that we can do about it. Okay, so my first interactive portion here today, we have a little poll. If everybody wants to participate here, what's the number one cause of cavities? Is it poor oral hygiene, frequent sugar intake, genetics, or soft teeth?
And Patty, it looks like the questions, the answers didn't get, we still have some of the old answers in that poll. So I apologize on that.
Oh, yeah, that's okay. That's okay. We'll take the other questions. Which we toggled between some different options for choices here. We've got answers coming in. I like that no one's picking eating lemons. Because who eats lemons? You know, nobody just eats those things. But I hear a lot of people putting them in their water. So, how we doing on the poll?
So it looks like we have just a couple more people who haven't entered into the poll quite yet. But we're about there. Lucian, I think we can end the poll. Oh, we got one more that just came in. So, and then I think, Lucian, do you want to go ahead and share the results,
Oh,
please?
yep, definitely.
Thanks.
Okay, I just see the results right now.
I, and since our participants are muted, I think everyone can see the poll results.
Okay.
But if you want to go ahead, Patty, you can go for it.
Okay, great. So it looks like not brushing your teeth came in at number one on the poll with very high majority in that camp. Sugar frequency number two, and not flossing number three. So I think this is really common that people think that it's not brushing your teeth. And I think that comes in at a close second. But it's actually sugar frequency that is the number one reason for cavities. When it comes to brushing and flossing, that does help prevent decay. It's more effective in preventing gum disease, actually. So we're going to get really into why the sugar frequency is so important, and that's going to be a big portion of this first half here. Oh, do I click the share results? I can't go to my next slide with the
Okay,
poll.
let's see if we stop sharing. Let's share the results. Stop sharing. And now are you able to go to your next slide?
No, it's not clicking over. Oh,
Oh,
the
there
poll
you
is
go.
still there. Can I just X out of the poll?
Yes, please do.
Okay. Okay, um, so let's talk about why it is sugar frequency. That is actually the number one answer. I still think brushing is important. This doesn't mean you don't have to brush your teeth. We'll get into that too, but the sugar frequency is the number one reason for cavities. So this slide, the cavity math is fun for me. Every year I go into schools, into my kids' schools and area classrooms, or kids come into my office and we talk about oral hygiene and how cavities form. And I use this cavity math graphic to help me. Cavities are the result of, it's a dynamic, multifactorial process that involves a susceptible tooth, cavity-causing bacteria, and carbohydrates or sugars. So the top part of the equation shows the bacteria that we have in our mouths, plus the sugary foods or carbohydrate-rich foods that we eat, and they combine to produce acid. So the bottom part here, the amount of time that our teeth spend in that acid environment determines whether a tooth gets a cavity or not. So we can control these factors of the equation to control the outcomes most of the time. We can brush our teeth twice a day and floss to reduce the bacteria that forms on the teeth. And we can control the amount of sugary foods that we're feeding those bacteria. And we can control how often, the frequency of the sugars that we take in. So that ultimately changes the time that our teeth are spent in the acid. Um, so, brushing is important because we need to reduce the overall bacteria in the mouth, but you'll see why that might be less of a factor when we look at what a normal day can look like. I wonder why. There we go. Okay. So here is a little graph. This is called the Stephen curve. And this explains a lot about how cavities can form. We learned this early on in dental school. It shows the effects of eating and drinking on the pH level in our mouth. So it's helpful for understanding how cavities can form. So it uses the pH scale, and that's a measure of how acidic or alkaline an environment is. pH of 7 is neutral. Anything below 7 is acidic. Anything above that is alkaline. And for teeth, we have a critical pH, and that is 5.5. So anything that's below 5.5 starts to demineralize or soften our teeth. So within 3 minutes, this little yellow line is kind of showing when sugar enters the mouth. After 3 minutes, you see that line dip down below the 5.5. And it usually takes our saliva 20 to 30 minutes to neutralize those acids in the mouth so that we return the environment back to alkaline, where our teeth can take the minerals back into the teeth and reharden. So when cavities form, they actually start as tiny white spots. They're like chalky white areas on the teeth that look almost like etched glass. They don't start as holes in our teeth. So at this chalky stage, the enamel is weakened, but it's not lost. So, every time we eat or drink, there's an opportunity to produce that acid, and that begins the cavity process. So the frequency of sugar is really what puts our teeth at risk. So now here, we don't just eat one time a day, like that one curve shows one dip, but we're going to eat many times a day. This is what the graph looks like when you take a whole day into account. You can see this process of demineralization where the line dips down into the red, and then remineralization is when it goes back up into the blue. So the goal here is to spend, you want to avoid spending time below that red line and spend more time up above where we're in the safe zone. That's where our teeth can absorb minerals again. So I know a lot of people who don't like water. They don't like the taste of water and they want to sip on something else. And whether that's sipping soda or any other sweetened drink or even diet soda, because there's acidity in that, or people sucking on hard candies or having frequent little snacks throughout the day, this causes us to stay below that red line in the danger zone for our teeth. So teeth need breaks throughout the day where they're not bathed in sugar and acid. It's in those breaks where the minerals in our saliva actually strengthen the teeth between meals. So this graph that we have up right now with breakfast and a snack and then lunch and a snack and dinner, this is okay. We eating 3 meals a day with a snack in between each one, no problem. The teeth are not spending too much time below in that red area, so we're safe here. So let's look at an example where we're not drinking water in between meals. We might have something like coffee, or we might have something like soda or crackers or candies. Anytime we have something that drops that acid level into the danger zone, we spend more time there. And the point here is that we might be spending more time than we even realize in below that 5.5 pH. And this has real consequences for our health and especially for our teeth. Um, we might do this and not even really understand that this is a process that happens naturally throughout the day. And the more we do this kind of snacking or just sipping on something all day that's not water, the more frustrated those patients tend to be at the dental office. So in this example, so this is why brushing is not the number one reason, because you can see if you brush your teeth in the morning and then you have this day where you spend too much time down in the red zone and then brush your teeth at night, the teeth, even with brushing, it's that all day slow effect of the acid working on the teeth that causes problems. So fluoride. Fluoride can be one of those hot button issues right now, but I just want to explain a little bit about how that works. A lot of dentists recommend fluoride, and the reason is our enamel is a crystalline structure. It's composed of hydroxyapatite, which is a combination of calcium and phosphorus, two minerals. And when fluoride is present with, if it's toothpaste or if it's fluoride treatments at the dentist or mouthwash or drinking fluoridated water, the fluoride actually goes into that enamel matrix, that hydroxyapatite, and it produces a stronger structure called fluorapatite. And fluorapatite is more resistant to acid. So normal enamel, like we were just talking about, breaks down at the pH of 5.5, which is not very acidic. When enamel is strengthened with fluoride, it gives you a little extra cushion. So the enamel can tolerate acid levels of 4.5 before they start to soften. So, I think fluoride is helpful. It is not magic though, because if we're not aware of the frequency of the acids and sugars in our day, then we can easily outweigh the benefits of fluoride through frequent sipping or snacking all day long. I still think it's helpful, but it's not magic. It's kind of like when people say that uh, you can't out exercise a bad diet. Like we can't out brush a bad diet either. So here we have a chart. This gets a little tiny, so I'm sorry. I know the writing is small, but I'll just kind of go over what this is showing. It's showing the different acidity levels of common drinks to give you an idea of where things fall on the pH scale. Because I think when we know where those things are, then we can make better choices. So pretty much anything that's not water is has an acidity to it that if we drink it all day long, it will cause problems. But at the bottom here, we have water. Water is neutral at 7. Even they have water and sugar down there as a 7 because sugar is not acidic all by itself. It needs the bacteria in the mouth to produce the acid, like in our little cavity math. But even flat mineral water comes in at a pH of 5.3. So technically, if you only drink flat mineral water all day, that can still cause a softening of the enamel. Sparkling mineral water comes in at 3.9, orange juice 3.6, Diet Coke has an acid level of 3 on the pH scale, very acidic. Uh, Regular Coca-Cola and Pepsi is at 2.3. Lemon juice is at 2. It's interesting that they have stomach acid on here at a 2 on the pH scale because, you know, uh, a lot of people suffer from heartburn. And if you have frequent heartburn with the acid coming up into the mouth, that can be very damaging to the teeth. So, managing heartburn is good for your teeth and a lot of other things. So it's very interesting because, water's really the only safe one. And I know that's boring. So what should we eat and drink? The main focus when we're thinking about what we're eating and drinking is foods that can maintain the neutral pH. It's better for our teeth. So things that are high in protein and healthy fats, lean meats, milk, cheese, nuts, foods that are lower on the glycemic index, which we'll touch on next. But this graphic is showing how many teaspoons of sugar are in 12 ounces of each beverage listed below. Another one with tiny writing, so I can go through it. But on the left side, with all those teaspoons, we have cranberry juice cocktail. So that has 12 added tablespoon or teaspoons of sugar. And on the far right, we have water. It's your best bet. It's naturally sugar-free. Um, I always tell my patients that I'm not going to tell you that you have to quit everything that isn't water, but just building that awareness around how often and when we're having these drinks can make a big difference. So if you think back to that curve, that Stevens curve from before, we just want to minimize the amount of time and the number of times that we're dipping our mouths into that dangerous acid zone below 5.5, or in the case of fluoride, 4.5. So if you're looking, if you're sick of water, you want to drink something else, the best time to do that is to combine it with breakfast or with lunch or with dinner, because that's consolidating it into um, a time where you're already eating food, and it's allowing you to have space in between those meals where the teeth can reharden. So the glycemic index that I mentioned, choosing foods that are lower on the glycemic index is better for your teeth and it's better for your blood sugar. So when it comes to teeth, it's the time and the frequency that matter most. But when it comes to blood sugar and diabetes, overall blood sugar awareness and control is very important. In dentistry, we see patients that have a hard time controlling blood sugar when they have gum inflammation, and vice versa. Having gum inflammation can make it harder to control your blood sugar. So these things really do go hand in hand. The glycemic index, it's considered low when it's below number 55 on the index. It's medium glycemic index, 55 to 69. And then high glycemic index foods, which are going to be more cavity causing and have more blood sugar impact, are greater than 70. So these charts are available to dig deeper into, but we'll keep going. So nutrition for older adults. When it comes to this, we have some unique nutritional concerns that relate to our teeth. As we age, our teeth do become more brittle. And now that can be from previous dental work or just from normal wear and tear. But we have to be a little bit more careful when we're chewing harder, crunchier foods. Um, those little rogue popcorn kernels can become especially problematic when we have those little cracks and around old fillings or just little cracks in our teeth in general. Other factors that play into nutrition are teeth that are missing, or when teeth start to wiggle, or dentures that don't fit well, or dry mouth. So all of these present challenges for chewing and for enjoying food. Um, I do think that good nutrition is very important, for your overall health, and it can make a significant difference when we're just trying to keep our bodies free from disease and our teeth intact. So we'll get into this. This one's a little blurry, but we do tend to think of kids as being the ones that eat more candy, but that might not be the case. I know I like my fair share of sweet treats. Reese's peanut butter cups are my favorite. But I try to keep my treats just to one time a day, rather than sprinkling them throughout the day because I just can't help it. In the back of my mind, I think about that curve and how much time I'm spending down in that acid zone. So, again, I'm not going to take candy away from anybody. That would be a sad, sad life. But I do think that just being aware of how often we do it is what's important. Okay, so nutrition for healthy teeth, bones, and gums. The overall goal is to aim to get a wide variety of whole foods in our diet every day to ensure that we're getting a full spectrum of beneficial vitamins and minerals for our bodies. I'm going to go through some here. This is not an all-encompassing list, but these vitamins and minerals support our bodies as a whole and our mouth. They play roles in reducing inflammation, controlling blood sugar, collagen synthesis, salivary gland function, producing saliva, and to remineralize our teeth and bones. The goal, of course, is to get as many of these as you can through your diet, but sometimes supplementation with multivitamins might be necessary. That would be, based on individual basis. So, vitamin D is a big one. That aids in the absorption of calcium and phosphorus, which is what our teeth are composed of. So, if we're low in vitamin D, it's harder to absorb those minerals. And magnesium for bone metabolism. Deficiency of vitamin D can be linked to gum disease, which is periodontal disease. Vitamin A builds and maintains our epithelium, which is like our skin and the tissues in our mouth, and it enhances your immune system function. It improves salivary gland function. Saliva is very, very important. We're going to talk about that in a little bit too. Iron and zinc are good for wound healing, collagen formation, and regulating inflammation. Inflammation is a big problem with gum disease. Next up, we have B vitamins. They aid in the formation of new cells, so helping with wound healing and collagen synthesis. Vitamin C is good for collagen formation as well. Deficiencies cause gingivitis. You've probably heard of scurvy. That's a severe vitamin C deficiency, and it causes really red bleeding gums. Calcium, good for building bone and remineralizing the teeth. Fiber. Fiber is great for controlling blood sugar, which reduces inflammation, and deficiencies in fiber can be linked to periodontal or gum disease as well. Only one more of these. These slides got a little boring compared to the colorful ones. Okay, protein. Protein is great for promoting growth and maintaining and repairing all tissues in your body. Lipids and fats, like omega-3 fatty acids, have anti-inflammatory properties. And then probiotics. So our mouth, we have like an oral microbiome, just kind of like the same in our gut, we have a microbiome. It's all the little bacteria and microbes that inhabit those places. And probiotics are great for strengthening the immune system and inhibiting the formation of like too many harmful bacteria. So we need bacteria, but we want to have more good ones than bad ones. That balance is important. We probably all remember the food pyramid, and thankfully, we're not using that anymore. I think a plate is a lot more user friendly. So we have the healthy eating plate. I like this. Harvard put out the healthy, Harvard Medical School published this, and it emphasizes filling half of your plate with vegetables and fruits. So there you're getting that good fiber and a lot of vitamins and minerals. On the other side, you'll see a quarter is recommended for whole grains. Again, more healthy fiber. And then protein like fish, lean meats, beans, nuts, things like that. We've got healthy oils, not a lot, but healthy oils give us those good fats, and then drinking water. So, structuring your meals this way and thinking about how you set up your plate not only benefits your whole body, but eating this way is likely to reduce your experience of cavities as well. So these are the hopefully simple takeaways that we can keep in mind after the webinar today. Number one, you want to try to structure your meal times. It's to prevent those frequent acid attacks. So having breakfast, lunch, and dinner with maybe a snack in between each one, but just giving our teeth time. So structure meal times is important. Number two, if you don't have a chance to brush your teeth after a meal, trying to end the meal with cheese or xylitol gum or rinsing with water. And the goal there is to bring the mouth back up to that neutral pH of 7, where the teeth can reharden again. And then 3 and 4 kind of go together, but it's so important. Choosing water over juice, soda, or sports drinks, and avoiding sugar or sugary snacks, like little crunchy sugary snacks, even if it's diet soda, because that contains acid. So doing these things alone will improve a lot of oral health troubles. So that part is mostly the nutrition part. Now we're going to talk more about the common dental problems that seniors experience. And there's more issues than this, but these are kind of the big ones. So xerostomia is the fancy word for dry mouth, and that's a big problem. Root surface cavities, tooth loss or edentulosum is another word for that. Tooth changes, like how our teeth change with age. Periodontal disease, which is gum disease. And we'll touch a little bit on long-term care facilities and issues that can arise in that setting. So the first one, dry mouth. We have our little mouth with the desert over there. Dry mouth is a very, very common problem, and it's kind of miserable. Like, it's just not fun to have a dry mouth. And the common causes are medications is number one. Medications like antihistamines, decongestants, antidepressants, blood sugar medications, all of these can reduce your salivary function. Um, how much spit can you form? Almost every prescription medication, there's so many prescription medications that have dry mouth as a potential side effect. And then with more medications added, that risk of dry mouth increases. Health conditions are a common cause. So things like diabetes, Sjogren's syndrome is a very common one for dry mouth. If you've experienced any radiation treatment in the head and neck area, that causes dry mouth. Parkinson's can reduce salivary function. Number 3 there is dehydration. This is a big one. We're just not drinking enough water sometimes, and that can make our mouth very dry. Being dehydrated makes your salivary glands not function well. Breathing through your mouth. especially at night. So ideally, if you have congestion, and it's from allergies or you have a cold and it's short term, that's not a problem. But if there's a chronic inability to breathe with the nose, dry mouth can cause problems with bacteria in the mouth. Excessive coffee and alcohol consumption and smoking all increase dry mouth. So those are the causes. What are the symptoms? So dry mouth is extremely uncomfortable. Patients who experience this have a lot of complaints. I feel for them. I try to recommend products, but the main symptoms are just that dry, sticky feeling in the mouth. They have a hard time swallowing, hard time speaking. The lips get real cracked. The throat is dry and scratchy, very thirsty. The tongue can be sore and dry. Bad breath is a common symptom because the bacteria just, they're unchecked because there's no saliva to wash them away. And it's harder to taste food. So that's not fun because I like to taste my food. And then when we get to, those are the symptoms, but the effects on the impacts of dry mouth on our oral health are significant. I see these impacts every day, and it is frustrating because patients who feel like they're doing everything right can still end up with cavities. They don't have the saliva to neutralize the acids to get out of that danger zone. From the acid standpoint. So uh, we need saliva to neutralize the acid. And if we don't have it, we are extremely high risk for cavities. I see more problems with gum disease because without saliva, the bacteria get more sticky and they stick closer to the gum line and it's harder to brush them off. Some patients have a hard time speaking or swallowing because everything in the mouth is just sticking together. The bad breath, we kind of talked about that before. The bacteria overgrow in the mouth without saliva. We are more susceptible to infections like Candida, which is a fungal infection of the mouth. You might have heard of thrush. That's a Candida fungal overgrowth in the mouth from not having saliva. Also, it can be very difficult to wear dentures or partials. It can be painful and sticky, and when we don't have enough saliva to lubricate the mouth. So big impacts. So what can we do about it? Staying hydrated with water is a big one. Really, if you have dry mouth, you have to stick to water. Sipping anything else, it's kind of like pouring gasoline on the fire. We just don't have the ability to neutralize acid, and so introducing additional acids into the mouth cause big problems. There are a lot of over-the-counter sprays or gels or moisturizers. Biotin is a common one that people use, and for the most part, I think like that one. Chewing sugar-free gum or sucking on lozenges that are sweetened with xylitol. So xylitol is a sweetener, but the bacteria that produce acid cannot use it to make acid. So it's actually very beneficial for the mouth. That Ice Cubes gum, that icebreakers in the corner, that's one example of a brand. I just threw one out. Most sugar-free gums do have xylitol as the number one sweetener, so they are good for your teeth. Um, the other thing you have to do with dry mouth is be impeccable with your oral hygiene. Highly recommend fluoride toothpaste or mouth rinses. Sometimes, well, most of the time, if dry mouth is an issue, I'm recommending a prescription strength fluoride toothpaste that has a higher fluoride content than you can get at the store. And avoiding caffeine and alcohol, and of course, no smoking. Smoking's just bad for us. We just shouldn't do it. So those are the big things you can do about dry mouth. It's a big issue and I see it a lot, and I really feel for patients that suffer from that. So next up, we have root cavities. How do root cavities happen? So over time, the root surfaces can be exposed, and that can be from chronic gum disease or aggressive brushing with hard bristled toothbrushes. Grinding our teeth can lead to recession. The recession exposes the root on the tooth. So our roots do not have enamel. The enamel part, the chewing part of the tooth, is stronger than the roots. The root surface is softer, it's more susceptible to cavities, and the decay or cavity can spread faster on the root surface than it does through the enamel part of the tooth. A lot of times this decay is happening in an area that's really hard to reach. It's hard to access these cavities to fix them. So sometimes we can't fix it, and it's a reason that a tooth might need to be extracted. Sometimes these cavities are just from not being able to get down there with a toothbrush, so not getting all the way down by the gums. And then back to that high frequency sugar and acid in the diet. Really being careful with the diet and not exposing the teeth to too much acid over time. So with root cavities, what can we do about it? Of course, just like anything else, prevention is number one. So trying to really think about those dietary things and the hygiene parts to eliminate or reduce your risk of getting those cavities. Going for routine dental checkups and cleanings so that we can try to find those spots if they are creeping up and catch them small. Doing risk assessment. Dry mouth patients need to be extra vigilant, managing the bacteria and sugar intake. Again, we have that prescription fluoride toothpaste sometimes can be necessary, and healthy diet, healthy diet. There it is again. All right, next up we have periodontal disease. So gum disease is the leading cause of tooth loss in adults. 45% of adults are affected by gum disease to some degree. I think that's a tricky number to tack down because I think it's just hard to know for sure, but it's a high percentage. And bone loss, once the bone loss is started around a tooth, you can halt it, but you cannot grow bone back. So why do we get gum disease? It starts with poor oral hygiene. So if we're not removing all of the plaque and bacteria at the gum line around our teeth, that plaque actually hardens to the teeth and it becomes tartar. So I have that little picture on the left side, and you can see on the left where it says healthy gums and healthy bone level. The bone should be up high near the neck of the tooth, I call it. And if we have chronic inflammation or bacteria forming that hard tartar layer on the tooth, the bone doesn't like that. So it starts to shrink away. It wants to get away from that bacterial layer. And eventually it creates a pocket, a deep pocket around the tooth that your toothbrush bristles can't get down inside. So over time, that bone is shrinking away. We're losing the bony support for the tooth, and that can make a tooth loose. And eventually it has to be removed. So, I wish access was so much easier for people because gum disease is very preventable with routine cleanings and daily maintenance at home. Um, and sometimes that can be hard. So, that poor oral hygiene, skipping cleanings, some forms of periodontal disease can be genetic, but that is very rare. And a lot of times, actually, we see those situations in younger people, teenagers that have the genetic forms. Smoking can cause gum disease. And we kind of talked about this before, where uncontrolled diabetes makes it hard to control gum disease, and uncontrolled gum disease makes it hard to control blood sugar. So these two things go hand in hand. So more with gum disease. What can we do about it? Like I said, with the bone loss, once we have bone loss around a tooth, we cannot grow it back. We can maintain it at the level that we catch it with periodontal maintenance cleanings. So those, instead of like a regular cleaning that you would go every 6 months or twice a year, the the periodontal maintenance cleanings when gum disease is present is going to be 3 or 4 times a year. And the reason that is because those pockets get deep and it's hard to get them clean at home. So more frequent cleanings at the office become very important. Um, obviously brushing thoroughly and flossing every day, quitting smoking. The actual treatment for periodontal disease that's active is called a deep cleaning or scaling and root planing. And then that needs to be maintained with those cleanings every 3 to 4 months. I did have surgery on here as a possible treatment in more severe cases. But if we catch it in time, mostly we can treat that without needing surgery. So we'll lead into tooth loss next, since periodontal disease is such a big reason for tooth loss. So tooth loss or edentulosum. I have a lot of patients who expect to lose teeth as they age. And that might be because their experience was that mom or dad or someone lost their teeth and they're just going to lose teeth as they age. But it's actually not a part of normal aging. Just because it's common doesn't mean it's a normal part. So unfortunately, this comes to access to care again, and we have challenges when it comes to access to care in dentistry. Uh, you know, I found some stats where 30% of elderly patients have untreated decay, 25% have lost bone due to periodontal disease. Adults over 65 have an average of 18 remaining teeth. 25% have no teeth at all. And I think a big factor is that a lot of Medicare plans have no dental coverage. So that access is a challenge. Um, couple that with fear of the dentist and cost of treatment without adequate insurance coverage. And it's no wonder that people avoid coming to see us. But sometimes by the time we find a tooth in a tough spot, it's too late and we can't fix it. So we end up having to remove the teeth. So there are some obvious negative impacts to losing teeth. It's harder to chew, and chewing is necessary to get that adequate nutrition. There are social impacts where people don't want to go out in public or see their friends if they have teeth that are missing, just dissatisfaction with the way things look. Missing teeth cases can range from pretty straightforward to very, very complex, depending on the individual and the anatomy of their mouth and the shape of the tissues. So having access to care is critical, and because the replacements are just never as good as the originals. Costs can be prohibitive, but replacing missing teeth can greatly improve the quality of life by improving your ability to chew and the appearance. The only way that we have to put back missing teeth, we have dentures, which are when all the teeth are missing. We have partial dentures, which would fit for this picture here on the left, where we have some natural teeth and we can clip on a partial denture to replace the missing ones, or dental implants are an option too.
So, Dr. Siegel, I know we're having a great conversation here, but we are getting close to the end. So we have about 3 more minutes for you, and I know you have a few more slides before
Okay.
we'll get to some questions that I see in the chat.
Okay, no problem. I am winding down. So the care for dentures and removable partials. So this is the one that I was talking about with nursing home patients, and it troubles me because I often see patients that have dentures in nursing homes and they're not getting cleaned. There's food underneath them, there's plaque on them, there's tartar buildup. Cleaning those is very important. I know that there are troubles with nursing home staffing and having enough help to do that and enough time. But, just simply brushing the dentures with a brush, and whether that's using a mild soap like dish soap, soaking the dentures overnight in water or denture soaking solution, and then also being sure to brush your gums and your tongue and the roof of your mouth with the goal of reducing that bacterial plaque. So tooth changes with age. We see a lot of wear. We wear through the enamel into the next layer, which is dentin. These can be challenging situations to fix because it's often not just one small thing. It tends to be a lot, but these are common changes that we see. And it can be from normal chewing, it can be from acid, it can be from clenching, grinding, using too hard of bristles on the toothbrush, but we see wear on the top and at the gums and at all areas of the teeth. So if possible, trying to restore those areas just to prevent further wear on the neighboring teeth. And if missing teeth, if you do have missing teeth, trying to put them back so that other teeth aren't taking extra force. That's an important thing to consider as well. So I know I kind of breezed through the tooth changes at the end, but that is the end. So just take care of your teeth and your teeth will take care of you. He has a little something there between his front teeth. I would tell him so he doesn't have to be embarrassed, but um, that's the end. I really appreciate you guys for listening today to the presentation. And I'm excited about questions.
Well, Dr. Siegel, thank you very much for sharing today. I'm sorry that we had to cut you a little bit shorter. I'm going to replace my screens right now with your screen. So I do want to say thank you to everyone for joining us today on our Aging Well series, and especially you, Dr. Siegel, for joining us today. Before we get to questions, and I know we do have a couple of questions here, after you leave today, you're going to be invited to complete a survey. And we do read those surveys, and we appreciate those. And everyone who enters the survey will be entered into a drawing for a free WeHa t-shirt. So very exciting there. Let me get my slides moving. The next two Age Well series are coming up. And on November 6th, we'll have Dr. Kipe, who will be talking about the impact of ageism on physical and mental health. So if you can join us that day, that would be wonderful. And then on November 10th, I have to the next slide here. And Dr. Kite will be starting off our week for social connection awareness and presenting Finding Your Third Place, Building Happier Communities. So you will get instructions on how to register for those. And with that, I'm going to stop sharing my screen. And we did have a couple of questions come in while you were talking today, Dr. Siegel. So I'm going to ask those questions. So do you know what black coffee has for a pH?
Black coffee, it kind of depends. These coffee connoisseurs who note the acidity in the coffee and whether, I think it's different. But coffee, if you're not using sweetener and everything is just plain coffee, I think it's better. I honestly, I don't know the exact pH, but I don't know. I still think water's better. So
Okay.
if you limit coffee to like a morning time, and we don't just drink coffee all day long, it really still comes down to what we're doing all day long. Because for
Okay.
stain and different things with teeth too, black coffee can be a troublemaker.
Okay. Thank you. We have another pH question about sugar-free, like stevia and aspartame. Do we know what a pH value of those types of products are?
So a lot like even when you think anything that has fizz or bubbles, it's like the process of making something carbonated makes it acidic. So, even if it's like Claire Brune, water that is unsweetened, that even has an acidity level just because of the bubbles. I don't know that aspartame itself has an acidity that's bad, but it's usually in something that has like citric acid, or some other flavoring that's going to be the culprit in causing problems. And again, this doesn't mean you can't ever have those things, but my recommendation when it comes to hydration is water. And if it's anything that's not water, just trying to combine it with a meal.
Okay.
Yeah.
Thank you. It harmful to whiten your teeth?
I think you can over whiten your teeth. Honestly, I think it's possible to overdo it. And the biggest side effect of whitening is sensitivity. So it uses hydrogen peroxide or carbamide peroxide, and it's not actually it, it doesn't really damage the structure of the tooth, but a lot of patients who whiten complain of sensitivity. So if you just do the normal course of whitening in a box of whitening or provided by your dentist, I think you're fine. And if you, annually want to do a touch up, that's not a big deal, but you can overdo it. It can cause a lot of nerve sensitivity to the teeth.
All right. Well, thank you. We did have a couple more questions, but our time is out of for today. But a couple of the questions was about osteoporosis affecting the problem. So I'm assuming talking to your healthcare provider or your dentist would be appropriate to answering that question as well.
Can I answer two
Um,
quick questions? I saw
yes,
one
please.
about toothpaste and dentures. Ideally, you do not brush your teeth or your dentures with toothpaste. Toothpaste is a little gritty. It has abrasive stuff in it, and that will pit the denture, so more bacteria and fungal infection type stuff can get kind of stuck in the denture. So just using a mild soap is best. Like think about it like you're washing your dishes. Mild soap is best. And then chewing gum all day. I just saw that one pop up. That's more of a muscle and TMJ problem. So, if your muscles and jaw joint can handle chewing gum all day, if it's sugar free, go for it. But I think that's going to lead to some muscle overworking, and that can lead to jaw joint clicking, popping, pain, things like that.
All right. Well, Dr. Siegel, thank you for your time today. We really appreciate you and everyone who was able to join us. So have a great day and thank you.
Thanks, everybody.